Hi there, our highly valued, treasured and esteemed viewers and listeners, and welcome back to your channel of choice. This video I am about to present was compiled by Dr. Nath Arua, a clinical pharmacist by training and profession who is the founder of Progressive Pharmacotherapy Consultants, the premier virtual clinical pharmacy institute for capacity building for healthcare workers. The Virtual Clinical Pharmacy Institute with a difference, where patient safety, medication therapy management and optimal clinical outcomes are very crucial and non-negotiable to us. Here we seek to remain your premier source of crucial tips for high-impact pharmacotherapy services. So, on behalf of the Institute, I humbly urge you all to sit back and spare me part of your very precious time to share with you very useful tips which may prove very, very handy in your line of duty. I now welcome you all to part 544 of our pharmacotherapy series, which majors in bipolar disorder. The first case reads, CNN, a 21-year-old woman, was diagnosed with her first episode of mania 3 weeks ago. At that time, she was hospitalized and treated with olanzapine 15 milligrams daily. CNN's was stabilized, and after 10 days, she was discharged from the hospital. She was scheduled to see an outpatient psychiatrist for follow-up 1 week later, but she failed to keep the appointment. Today, CNN arrives at the emergency department at the request of her mother. CNN is grabbing her mother's hair and kicking wildly as she is pulled from the car. She can be heard screaming, "The FBI is after me, Mom. You want him to find me, don't you? I would have made it out of the country if you hadn't gotten in the way. I was going to marry Prince Charles and become the new Queen of England." On evaluation, CNN's mood is irritable, and she is pacing around the interviewer. She is dressed in a short skirt and high heels and is wearing an excessive amount of makeup and costume jewelry. During the interview, she interrupts the examiner, smiles, and says in a loud, provocative voice, "Let's you and me get out of here." Her mother states that after CNN was discharged from the hospital, she stopped taking her olanzapine due to gaining some weight and, within several days, stopped attending her classes at the local community college. She began staying out late, playing her radio loudly, and driving recklessly, finally hitting the side of the garage while parking early this morning. The clinician would like to admit CNN to the inpatient unit and initiate lithium treatment. So my first question to you reads, what laboratory tests are required before initiating lithium therapy for CNN? Because lithium can affect many organ systems, baseline laboratory values must be evaluated before therapy is initiated. Baseline laboratory tests are useful in determining contraindications to the use of lithium or conditions that may require an adjustment in dosage. As a young, healthy female, CNN's pre-screening laboratory battery should include electrolytes, blood urea nitrogen, creatinine, urine-specific gravity, thyroid-stimulating hormone, abbreviated as TSH, thyroxine, also called T4, and a CBC. Also, a pregnancy test should be obtained before starting therapy since lithium is a known teratogen. CNN's baseline laboratory parameters were normal, and her pregnancy test was negative. So my next question to you reads, how should lithium treatment for CNN be initiated? Although there are many strategies for calculating lithium dosage requirements, it is simplest to begin CNN at a dosage of 300 mg twice daily. This is a common starting dose for a healthy adult patient. Patients experiencing an acute manic episode require higher lithium levels compared with maintenance therapy. The goal for the acute management of CNN is a serum level between 0.8 and 1.2 milliequivalents per liter. Because lithium is not immediately effective, CNN's lithium dosage can be adjusted based on the results of lithium serum levels checked weekly until the manic episode resolves. As she recovers and enters the maintenance phase of treatment, both CNN's lithium dosage and her lithium levels will require re-evaluation. The next question reads, how long will it take for CNN to get the full effect of lithium? The half-life of lithium in a young patient with normal renal function is approximately 24 hours. Therefore, steady-state concentrations are typically achieved in approximately 5 days. The onset of action is slow, taking as long as 1 to 2 weeks to fully exert its therapeutic effects. Because of the delay in onset, it is appropriate to use an adjunctive medication to help reduce CNN's acute symptoms. Both benzodiazepines and antipsychotics have been used in this manner. Atypical antipsychotics are preferred over typical antipsychotics and have been demonstrated to enhance efficacy and accelerate time to response when used in combination with lithium in acute mania. Benzodiazepines work rapidly to reduce agitation, anxiety, and decreased need for sleep. So there you have it, our highly esteemed viewers and listeners. That brings us to the end of this video. If it benefited you in any way, kindly remember to give it a thumbs up, to like it and to share it widely with your peers. Please leave your comments at the bottom. And if you haven't yet done so, I humbly urge you to subscribe to our YouTube channel. I would like to promise you all that the very, very best is yet to come. Thank you very much for viewing this video. On behalf of our senior colleague, Dr. Nath Arua, I sincerely appreciate your partnership, continued support and kind collaboration. We look forward to interacting with you in the next video, which will be part 545.